So, hi, it's Dr. Chris again. So, all right, a couple things. You notice that extension this way or the press-ups like we talked about earlier hasn't been helping. You may be one of those few people who might respond better to what we call a flexion, all right? People are different. There is no cookie cutter solution for a lot of things. This is why we have to examine a lot of things and figure out what may be the best movement, positioning that can be helpful for a lot of folks. So if anything, we could do some flexion type of exercises. All right, so a few things that you could try doing. If you could help it, especially if you're home right now, you probably have more options like this. You could lie on your back. Now, this is very important. If you are lying on your back and you're having back pain and your legs are straight, definitely bend your knees already, okay? It takes the slack off your lower back. But you could do this. It's called a knee to chest exercise where you can actually bring both your knees, hold it for about 5 seconds or so, momentarily release, then back again. Now, this is about roughly 10 times. If you notice that your symptoms are improving, well, that's a green light. Definitely go ahead. 10 times, maybe 3 sets of 10 or so throughout the day. You know, again, every 35 minutes or 45 minutes, take a break. This is something you can do. Another alternative, pretty much same principle. Maybe one knee to your chest. If your back pain is really aggravated, you can do have your knee slightly bent to the other knee, and back and forth. The theory behind that, it also helps with bending or tractioning out the lower back itself, the vertebrae. Also with stretching some of the muscles and ligaments, and theoretically imbibing back the loose material of the disc that might be injured. Again, these are all certain things that has helped over time for a lot of folks. Not every movement's the same for everybody. Everybody's situations and their body's symptomology, they're all different depending on certain cases. But you can definitely try these at home. Definitely gonna be a little bit harder when you're at work. Now, the next move I could show you that could be as an alternative, if you're sitting down, I could definitely show that again for some sort of flexion exercise. I'm not necessarily opposed to this, but when you're really experiencing a lot of back pain, I know a lot of people like to bend forward this way, that rounding of the back tends to also aggravate it. So let's try to avoid that if you can. Once again, if there is any other questions, you should really definitely consult with your healthcare provider. Dr. Chris again, and I will talk to you guys soon.